Home care packages are meant for older people, but there isn't a minimum age. Anyone can access a home care package. You don't have to be an Australian citizen or an Australian resident, but they're not designed for people who are visiting the country. Home care packages are not designed for temporary care. They're more longer term care packages. If you're looking for shorter or temporary care, you might be better off accessing the Commonwealth Home Support Program. If you've decided that you'd like a home care package, you first need to arrange an assessment. To arrange an assessment, you need to contact My Aged Care. My Aged Care will then arrange for the aged care assessment service to undertake an assessment. Home care package assessments are completed by the aged care assessment teams or aged care assessment service in Victoria. An aged care assessment service team member is normally someone with an allied health background who'll come and visit you and determine your eligibility and your approval level for a home care package. The aged care assessment team can also provide approvals for residential respite as well as permanent residential aged care. These assessments are free. To arrange an assessment, contact My Aged Care. If you require an interpreter, one can be arranged for you. Before you call, have your Medicare card number ready, also the name and details of your doctor and a family member. Have a think about some of the questions that you might want to ask, but also some of the things that are troubling you at home and you think you need some support with. My Aged Care will ask you some questions about your living arrangements, your health and well-being, things that you find difficult, and also the support that you're currently receiving. Based on your answers, My Aged Care will work out if you need an ACAS assessment or if you require another assessment for a service such as the Commonwealth Home Support Program. They'll also help arrange a time for that assessment to occur. During the ACAS assessment, the ACAS worker, who's normally an allied health professional, will come into your home and want to know about your individual circumstances and what areas of your life are you having some difficulties with. They'll also explain the assessment process. The assessment is an opportunity for you to explain what's important to you and what supports would make a difference in your life. It might be helpful to think about some of these questions, and especially the things that are important to you and would make a difference before this assessment occurs. During the assessment, you're able to have someone close to you, someone who knows you, present to be a bit of a support during this process. That might be a friend, neighbour, family member or an advocate. After the ACAS assessment, the ACAS member will write to you advising of the outcome of the assessment and the level of home care package approval you've been given. You can then choose to decide if you want to accept that level of package and go onto the national queue and wait for a package to become available. Once you've been allocated a home care package, you have to then choose a home care provider. You've got a period of time to choose a home care provider. You've got 56 days, but if you need more time to do that, you can ask My Aged Care for a 28-day extension. Home care package providers vary from non-for-profits, for-profits, and also local government services who provide home care packages. The home care provider administers your funds. So the government provides them with the subsidy. They take out their component of case management fees and administrative fees, and then they work with you. You've allocated a case manager and they work with you to develop a care plan and purchase in services for you. In metropolitan areas, there are many providers to choose from. In rural areas, there aren't as many. To find a provider, probably the first step would be to go onto the My Aged Care website and enter your postcode into the service provider tool. This will generate some providers for you to actually start contacting and getting an understanding about which one's going to meet your needs best. Having a lot of choice is a good thing, but if you don't understand your options, it can be confusing. At Live Well Care, what we try and do is support you to understand those choices and make informed decisions when choosing a provider. When choosing a home care package provider, some of the things you may want to consider are the variety of services they provide. How flexible are they? Do they outsource services if they can't provide them themselves? Are they happy to subcontract? You may have services that you're actually engaging at the moment and you want to continue using them. Your case manager, how often will you see them? What can you expect from the case manager? You're paying a fee for that case management service, so what does that include? Are you able to self-manage your care plan and your budget? What's the reputation of the service provider? What are their costs and charges and how do they compare to other service providers? And if you're from a different cultural background or have specific language needs, do they have staff or carers who can actually speak your language. They're just some of these things that you need to think about. Write some of these down and have these ready to speak to providers when you meet with them. From the time you're allocated a package, you've got 56 days to choose a provider. If you're struggling with that amount of time to choose a provider, you can ask for an extension by calling My Aged Care. They'll give you an extra 28 days. But if you don't choose a provider within that time, it's important to remember that that package will be put back into the national queue and you won't have access to that. While the system enables greater choice, our experience tells us that people are required to make more decisions when finding a home care package provider. This presents challenges for some of our consumers, especially those who are vulnerable, those people who don't have English as a first language, who may have some cognitive decline or have limited family support. What we like to do is support them to navigate the system and be able to access a provider that's going to meet their needs.